Hello, I'm John Perry, and we're here in the Speaker's Library at the State Capitol in Lansing to talk about Mental Health Awareness Month in May. I'm joined today by Representative Hank Vaupel, who's the chair of the House Health Policy Committee, and Representative Daire Rendon, who's the chair of the House Family, Children, and Seniors Committee. Representative Rendon, you've been telling me that as we think about behavioral health, another term that we use for mental health is behavioral health, and that's maybe a good prism with which to look at this whole issue.
I think it is, John. Thank you. I think that behavioral health is evident in people of all ages, and particularly in young people. And the people that might be aware of it are when a child goes to school and a teacher might observe some behavior that might indicate that a child has an issue that should be maybe tested for or looked at. Oftentimes, and I'm going to talk about ADHD, that's a behavioral health issue. And if it's not addressed in a timely manner, a child might feel a little frustrated in school, and that could lead to something else. The key is identifying behavioral health issues that could lead to the mental health issues that we're dealing with today.
And you talk about the child feeling frustrated. The family of that child can begin to feel frustrated too.
Certainly they can, and the family and the teacher. And so testing, observant people working in the classroom, that all contributes to getting the child on the right path that he or she needs to be productive and to learn in the way that's easiest for them to understand. It doesn't say that the person isn't smart enough. It just says that the individual needs to be taught in a different way. That's just one thing. But we see behavioral health too in youthful offenders who are doing things that are out of character for them. Sometimes that's an indicator of an underlying problem. That could be either a genuine mental health issue or it could be a substance abuse issue.
And Representative Hank Vaupel, you and I have talked about this, where when we talk about mental health issues, quite often there is a link to issues with substance abuse.
Very definitely. I think if you look at most of our issues with substance abuse, there is a mental health factor, a behavioral health factor in there. And I think on the far end of it, we have our prisons that certainly many inmates suffer from mental issues and drug issues going with it, even prior to having contact with the corrections system. Their mental health plays a big part in some of the crime we have, certainly in the family relationships that we have. And going back a step further, as Representative Rendon said, schools are, many of the kids that have issues in schools, it's behavioral issues that start. And I think identifying it early and even looking back prenatally at some of the issues like that cause the fetal alcohol spectrum disorder, and we're now having babies born with opioid addiction, and I'm sure some of the mothers do have behavioral problems, and drugs is one of the answers for them to it. And so we have to look at our behavioral health, tie our behavioral health into our physical health also, because I think integrating that, a lot of our physical health problems stem from mental health problems.
And it really underscores the reality, doesn't it? That at the bottom line, we aren't talking about a human equation here.
Absolutely. We look at the cost, the dollar cost of mental health, what it is, but the human cost is much more tragic. The family relationships, the ending up in prison because of behavioral health problems, mental health problems, that's the real tragedy.
And Representative Rendon, it is an issue that lawmakers are investigating, looking at right now at the state capitol.
Yes, they are. We just passed a package of bills, I think it was last month, that addressed a lot of these issues because there is a new initiative to make sure that those offenders whose underlying reason for criminal activity is a behavioral mental health issue, that they get the help that they need so that they can, many of them can be rehabilitated. And that's what we're ultimately about, is keeping them out of our long-term prisons and getting them back into society as a productive member or as someone who can lead a higher quality of life simply by addressing the issues that they have. We've come a long way in the areas of mental health, but there's still a stigma to it. And I think we need to start focusing on how we can get our message across that mental health is just as important to us as our physical health. It all works together.
And Dr. Vaupel, actually, that is an issue that lawmakers continue to work on, even as we speak here right now.
Absolutely. I think some of the legislation that's out there now for opioid abuse, drug addiction, it all stems from mental health a lot. And we're trying to look at it in an integrated fashion so that we don't just treat one point or the other, that we must treat all of it together, and we must eliminate that stigma. Mental health is not something that a person chooses to have a problem with. It's there, and the devastation on family relationships, devastation in people's lives is a tragedy, and the earlier we can pinpoint some of the problems, the better everybody will be, the better society will be, the better the people that are afflicted with mental health issues will be.
Okay. Representative Hank Vaupel, Representative Daire Rendon, thank you both very much. Appreciate it. And I'm John Perry. Thank you for joining us.